Welcome to Mom in Mind, a podcast about maternal mental health from conception, pregnancy, to birth and postpartum. Real stories from moms and family members who've made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. We discuss very real struggles that can sometimes be hard to hear, but these are stories that need to be told so that moms and families can know that healing is possible. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional or professional training. Thank you for being with us today. Welcome back to Mom in Mind. I'm your host, Dr. Kat. In this episode, we are talking with Shivonne Odom, who is a licensed clinical professional counselor and founder of Akoma Counseling Concepts, LLC. Akoma Counseling Concepts is the only minority-owned private practice in Washington, D.C. that focuses on minority maternal mental health. Shivonne provides continuing education trainings on cultural competence and minority maternal mental health. She loves to promote awareness on minority maternal mental health via community panel discussions, podcasts, and local media outlets. She is passionate and excited about all things mental health and advocacy for women's health initiatives. And in today's episode, she's going to be talking to us about some things that, frankly, she's had on her mind and I think everybody needs to hear, and really about us needing to have more culturally competent services, the need for more therapists of color to be trained in perinatal mental health, and talking about stigma around postpartum depression for Black moms, and also touching on how some organizations can do more to support perinatal mental health. I'm excited to bring you this discussion today. Let's meet Shivonne. Welcome, Shivonne. Thank you so much for being with us.
Thank you. Hi.
Hi. So grateful that you're on with us today to share your wealth of knowledge and really speak to some points that I know you're really passionate about and I think also really need to be heard. So if you can, just start with us where we'd like to about your path here.
Yeah, so I started my practice about a year ago, Akoma Counseling Concepts in DC, in response to my realization that there are no therapeutic spaces around here that are primarily designed for moms of color pertaining to PMADS. And so I just was like, well, I guess it's time to bring that to my community.
Wow. That's great. And that's not a small thing to just start up either.
No.
But you felt that call and went for it.
Yes, I did. I would definitely have to attribute it to my graduate school alma mater. So I went to Howard University for my master's degree in counseling. And basically, a lot of the framework for my studying was a social justice framework. And so really, it just inspired me as a clinician of color to create spaces for communities of color if we don't see them, because people do need safe spaces.
Yeah, absolutely. Absolutely. So you saw this gap or hole or whatever you'd like to call it in services and decided to begin filling it.
Yes.
Wow, that's really, really great. I mean, it's hard to see that gap there and then starting the work on filling it. You've come a long way in a pretty short period of time, I think.
I mean, I'd like to think that I still have a long way to go because there's so much work to be done. There's so much.
Right. So how did you get into this particular line of work?
So I got the wonderful opportunity to work at a community healthcare clinic in the District of Columbia a couple of years ago. And I saw that a large number of our population, if I could put a percentage on it, it would be about 90% of our population were African American. And part of what made my position unique was that I got to provide behavioral health services to the perinatal population. So it was really cool to meet moms in their prenatal visits and then see them after they gave birth and to provide behavioral health interventions postnatally. And so what I was seeing was that there were a ton of healthcare services being offered to these women, but there were no behavioral health services being provided. And again, as a provider of color, providing services to moms of color, knowing very well about the maternal mortality rate and, again, the high rates of PMADS within the African American community, I was just really, really stunned that there wasn't a place for women of color to go for their maternal mental health needs. And I mean, I did. I researched, I looked around for it, and I would see on different websites like LinkedIn or Psychology Today that there would be some therapists that would say that they specialized in perinatal mental health, but they hadn't completed any formal training in perinatal mental health whatsoever. And so I decided to have a lot of courageous conversations with some of my then patients and some of the birth workers that I had worked with. And I decided to meet some reproductive justice workers. And I got really inspired to create Akoma Counseling Concepts. And I desired, and I made sure that I did, that I would also apply to be credentialed on as many health insurance companies that would allow me, because I know that one of the barriers to moms of color seeking out and retaining mental health services is lack of insurance. Because many perinatal providers, they provide services, but they don't accept insurance, which means a large population of moms don't get the care that they need.
Right, right. So in your process, you're really keeping all of this in mind to make sure to have things as accessible as possible for as many people as possible.
Yeah.
Yeah. I mean, these are really, really important points. Can you speak a little bit more to what you saw in that clinic that you were working in?
Sure. So I was seeing that there was a behavioral health department, but our focus was on diabetes. It was on hypertension. I think something that's significant to note is that there was a huge focus on reproductive services at this site. So again, I was just shocked. Like, there was a lot of education around birth control, a lot of education around healthy eating. But again, behavior health supports were really to do things to help minimize blood pressure and, again, rates of high diabetes A1Cs. But there were no providers that were screening any of these moms for postpartum depression. And if they were using these screens, there was no room to invite culturally competent screening tools into the mom's prenatal or postpartum visits, nor were moms screened at the baby's first well check. And I really thought that was interesting, because this clinic thought that it would be great for stranger me to come in and screen because, oh, she's a therapist and she's Black, but they weren't paying attention to the fact that one of our greatest trust bonds were already established, and that was between the medical provider and that mom. And so that mom was much more likely to give truthful, realistic answers to her medical provider than myself, the new therapist, for the fact that they didn't know me. And so, again, that was one of the instances that I was seeing where there was a lack of culturally competent care.
Right. And then they're asking you to step in, asking about mental health, which I know you wanted to make sure we talked about the stigma around that.
Yes. So I think that, I know there is a huge stigma pertaining to mental health in the African American community, but that becomes a lot more sensitive when you're speaking to someone when they're pregnant, they're postpartum, and you're asking very straight to the point questions about their mental health in a system that culturally people of color do not trust, which is the medical system. Right. So there's that huge fear of, oh my gosh, if I tell what I'm really feeling, is this person going to take my child from me? Is this person going to say that I'm not a fit mom?
Right.
So yeah, there's all those factors.
That's really, really scary. And then the clinic experience that you're describing, it's hard to know if people had already had experience in that clinic or they're just stepping in for perinatal care. But certainly to your point that having a stranger come in is really hard. It's hard to open up. And I think what you're also mentioning is that this was part of maybe the clinic, or just if we can generalize everywhere really, that not being aware of these factors and how it might impact someone being able to be honest or to reach out for help in the way that they deserve.
Yeah, because it's a privilege. As a healthcare provider, I think it's a privilege for me to be a part of someone's care and wellness. My patients didn't have to choose me. And so they didn't have to choose their medical provider. And so I think that that's important when we're talking about providing culturally competent care, that we shouldn't just skip behavioral health measures because, oh, it's not important, or because I think that it's not important, or, you know, I'm going to provide this tool because I think so, because I'm the medical provider, and totally missing the whole point where it's just like, that's great, but if this person doesn't trust you or that tool that you're using or your rapport, you're not going to get the info that you need.
Right. And I think also to another point you made earlier is that it sounds like in general, but maybe specifically at this clinic, but also in general, there's a really big lack of understanding at how depression and anxiety and stress could be impacting all those other medical factors.
Yes. Big time. Big time. I guess I cannot stress more just taking the time to just understand what exists in the communities that we work in, like literally what's happening across the street or the next block over.
Yeah, I mean, that is part of what you're describing for culturally competent services, understanding the environment that you're in.
Yeah. One personal experience that I had was the neighborhood that I worked in, I had also lived in. And so I just remember one night I woke up and I heard some not so nice sounds. I was hearing gunshots. And I mean, these were just like really intense. And so I remember coming into work the next day and saying to someone on the clinic floor, like, hey, you know, I just want to let you know, people might be a little bit moody or a little bit on edge because last night was really rough in the neighborhood last night. It was really rough. And there was at least 2 times where that had happened. One time, nobody took anything I said into consideration. And, well, it was a very eventful day that day. Very eventful day. The next time where people did take those things into consideration, you could definitely see a major difference in just the tone of voice and in the rapport between both the patients and the provider. Right. Because some populations, it's important for us to know that you get our environments and, you know, what we're currently living and experiencing.
Yeah, that's so important. And also, I kind of wish that, you know, providers would just assume, or maybe, I don't know if assume is the right word, but like assume that people who come into you because they're having a hard time and not just be treating them like they're supposed to be just fine.
Right.
You know, like people are coming in for either medical care or mental health care for a reason. What you're describing should be just standard.
Yeah, and that's the other thing. And once again, is that with my experiences, just healthcare wise, not just specific to this clinic, is that a lot of times mental health needs were not even addressed in their prenatal visits or their postpartum visits. They just weren't. Unless I was working specifically on a psychiatric unit or providing consultation to a psych unit for a local hospital, these behavioral health needs were not taken into consideration at all.
Wow. Oh, right. So, and that's just behavioral health in general, let alone specifically focusing on perinatal mental health. What have you seen in terms of pushback or acceptance of perinatal mental health?
I can laugh.
Okay.
So while my area of expertise is needed, it's still pretty new. And so because of that, I get pushback from the most unexpected places. So for example, I get it from some of these reproductive rights organizations. They like to talk about birth trauma, but again, due to the negative stigma that exists in the Black community, we have some of these reproductive justice organizations that heavily focus on maternal mortality for women of color, as we should, as are needed, but they will not address mental health at all. Like, they won't provide a training on it. They won't do any like public community advocacy or awareness on it. Like, there's just a total disconnect. And so I've gotten pushback. I've gotten pushback from some reproductive rights organizations when I'm like, hey, why don't we partner to do a training together? Or why don't we do a community event together? And they're just like, no, we just want to have safe pregnancies and healthy babies. And I'm like, well, there's something called the postpartum period that can really, really impact those mothers and those babies. So just giving birth to the baby and the baby living that day is not enough. Like, there's a lot of work that needs to be done beyond that day to ensure maternal mortality rates can be reduced. And actually, I heard that there's some efforts that are being done to kind of extend the period of review for maternal mortality beyond just like a couple of weeks to like the whole first year after.
Yeah, it would be really great if we could start really looking at this kind of information, because it seems like we're missing a lot of stuff, a lot of information.
Yeah, we are. A good example of this is Erica Garner. She was the daughter of the victim of police brutality, Eric Garner. And so people have been talking about extending the study of maternal mortality beyond just the delivery period, but close to like a year postpartum. And so for moms of color, I think that Erica Garner would be an example. Many people, they say that, she went into cardiac arrest and she suffered from brain damage and due to a lack of oxygen, and that's why she died. But what people aren't looking at is just her exposure to trauma, her significant exposure to trauma in such a short time, leading around and to and after her perinatal period. And so I think she's definitely a unique example to how PMADS got overlooked for that mom of color, because I could begin to imagine the emotional issues she may have been struggling with.
Sure, right? Yeah, I mean, that makes so much sense. And I think, a lot of your points and very strong points are to the fact that we have still really separated out how mental health and stress affects people physically, that like somehow they're two different things, but this is all in one body. It's all happening in one soul. It's happening in one place. And how can these things not impact each other?
Right.
It's crazy to make these assumptions. And I mean, I really hope people can hear what you're saying about the importance of really including mental health in the assessment of what's going on, but very particularly perinatal mental health. This is so important. It feels like it's at the core of a lot of stuff.
It is. I mean, again, I cannot begin to imagine what her pregnancy was like going into her pregnancy, knowing that her father would not be around to see her give birth to her son, but also just the circumstances in which her father died. And, of course, they're just saying that she suffered from the effects of an enlarged heart after giving birth to her son 3 months prior. And it was just like, yeah, but what led to that?
Right.
What led to that?
Right. Yeah, absolutely. So if we're going to be preventing stuff like that from happening, I mean, your great suggestions are to make services more culturally competent and to make sure that more therapists of color are being trained in perinatal mental health, which absolutely needs to happen. What are your thoughts on that, or how to get it to happen, or what should we be doing?
So my thoughts are, yes, we need to have more providers of color trained on PMADS. One, because studies show that patients of color more positively respond to mental health therapy when their provider is a person of color. Two, I also think that, more people in general, no matter what your race or ethnicity is, they also need to participate in both training on PMADS, but also culturally competent care during the perinatal period. Because there are certain questions that if you ask a mom of color, it's taboo. You just don't do it, but you can still get some of the information you need, but asking in a more culturally informed way.
Right. So, a lot of mental health and healthcare providers make assumptions, or they're in clinics where it's just, one person after another, and they don't have the time to really maybe be thoughtful in the moment. So having training on how to be thoughtful in the moment and conscious in the moment when you're with people, it seems pretty imperative.
Yeah. And this just might be my personal bias, but I just think that cultural competence trainings should not be optional, because if you're a therapist or if you're a reproductive worker, I mean, we work with the public. So we communicate with a lot of people from all walks of life, and we're supposed to be humanizing people's experiences in the most therapeutic and supportive way. And so we can't do that if we're not informed.
Yeah. And I think, I hope anyways, my hope is that we're moving towards a system that's less top down, where it's like not too long ago, all healthcare providers were white men, and we're moving towards a more diverse healthcare provider field, but it still needs to be that. But I think what still happens is that there's this idea that the doctor still knows best sometimes, and because this is how they were trained, and that they have this title that they can sort of tell people not always what to do. And again, I'm overgeneralizing and stereotyping based on an old model. I think it's changing. But if we don't start to incorporate understanding that no, not all people are like straight white men, then we're missing really healthcare. We're missing on helping out people, in the way that they feel healthy.
I'm glad that you mentioned that, because heteronormative care is definitely dominant in healthcare. And we definitely need to have a more diverse view of patient-centered care.
Right. And you yourself are offering some of this training.
Yes, I am.
This isn't some like, oh, somebody should do this someday. Like, this is what you're doing.
Yes.
So can you tell us a little bit about the program that you have started?
Sure. So I created a training that's accredited by NBCC for 3.5 CEs. It's called Perinatal Mood Disorders and Minority Mental Health. I'm offering it as a webinar on September 28th. And so the whole purpose of it is just to be able to discuss and identify cultural and spiritual issues in PMADS, and to culturally assess for PMADS, or have culturally informed methods to assess PMADS, and also to have a better understanding of risk factors and barriers of treatment for PMADS and women of color. Also to explain a little bit of just some of the history of perinatal health and how that impacts mental health in the African American community. So, for example, when I chose to go into the specific niche of minority maternal mental health, I had to learn about the whole culture of doulas, because historically in the African American community, doulas did it all. They were the best friend, counselor, the nurse, the doctor, the cook, all of that. And so I think once I began to learn more about just the history of doulas in the African American community and their importance, and how to really inform my therapeutic approaches to working with my moms.
So what are some other things that people could be learning from you during this training?
So they can be learning, what does a therapeutic dialogue with a client of color sound like? Yeah, what does it sound like? Or what might help-seeking behaviors look like or sound like for a mom of color that's experiencing PMADS?
That's great. I know you've done this training before. What has been your experience in terms of what people leave with?
Oh, wow. So I first hosted it at Howard University. And so it was a very powerful, but very, I don't want to say sisterly, but kind of like that. People left very happy. They left feeling a sense of connection. And people actually established professional relationships with each other after going to this training. So what was really cool was that there were medical providers sitting down at the table with therapists, having conversations that we don't typically get to have, which is like, oh, you only get 20 minutes to see a patient? Oh,
right.
So, yeah.
Yeah, that's really great. Oh, so you're not only are you providing training and information, it's a place for people to connect and connect ideas and maybe even connect professionally, which is just phenomenal. I think that's really essential to growing this. And, I think you were talking a little bit more about the need for more therapists of color to be trained in perinatal mental health. And I'm really hopeful that the conversation that we're having today is, heard by people who are considering getting this training, would be like a specialization beyond what the 2-day of PSI does.
Yeah, so this is definitely specialized because it's in addition to.
Okay. Yeah. Okay. Right. So there's all this opportunity for people to get general and fundamental training in perinatal mental health through a couple different organizations. But what you were offering is really specialized.
Yes. And I can say that if you've never gone to a PMAD training before, you could still attend mine because I do provide a general overview of PMADS before going into the whole cultural piece. Because I do understand that just like the clients that we serve, that many clinicians have never had any formal training in PMADS.
Right. I mean, there's so many of us. I didn't. When I had my own experience, I didn't know what was going on. And I was a psychologist already. And I know for a fact, I hear it over and over again, that people just they haven't heard of it. They don't understand what it is, or they only associate it with what they see on TV, or, that's only for a certain kind of people that get that. And just this is why I think this discussion is so powerful, because really just bringing it down to earth, saying these are the things that we need to address. This is what's possible to do with it. Here's a training. This is all very accessible. And that's what it needs to be in order for people to learn and to get the training, and then to go out there and either, get the help that they need or become the help that somebody else needs.
Yes, that's the exact purpose right there.
Let's do this.
That's the exact purpose. And I really wanted to, and I really wanted to say that on this podcast, doing this work has been one of the most rewarding forms of therapy I have ever done, and so I definitely think that we should get more providers of color to do this work. I mean, because just doing this work, again, it helps so many women. It also saves many families. The community within itself, oh my gosh, is one of the most supportive, sisterly communities I've ever been on in this field, so that we can create more safe spaces for women, because moms deserve mental health, and right. That's the other reason why I chose to do this training, is because sometimes we can be socialized that it's selfish for us to just look at our emotional and mental health needs, that we're really supposed to just look at only our kids. And sometimes due to the professionals or the people around us, we're also told that we can't even experience these things because we're professionals. I mean, I've had the experience of working with some professionals that have just been like, oh yeah, no, you can't have these issues and be a therapist. And so once again, that's the cultural piece, with the stigma. So
yeah. Oh, that's so important to talk to speak to. Thank you for saying that. Yeah. I mean, the more we can talk about it, the more we can put it out there and get information out there, the better off everybody will be. You're doing a really big part of that work, and you're set up there in DC and doing the work on the ground there. But then to add this other webinar so that other people can get access to it that aren't necessarily near you, that's really important. I just think it's great. Just the more things we can make accessible to people in multiple forms, the better off we'll be.
Yeah, I definitely agree.
Yeah. So I want people to find you. Can you tell people what your website is and how they can connect with you?
Sure. So you can find me at www.akomacounselingconcepts.com, and that's AKOMACounselingconcepts.com. And I am on Instagram, which I think is a cool place to find me, because every now and then I do Instagram live chats about PMADS. And so you can find me at Akoma_counseling on Instagram. And you can find me at Akoma Counseling on Twitter. And you can also find me on Facebook.
Sweet. All right. That is awesome. So everybody, please go check that out. And the webinar is on your website under training, correct?
Yes, it is.
Okay. And also, Shivonne is offering a discount to all of the Mom in Mind listeners, which is so generous and so awesome. So if you guys go to her website, Akoma Counseling Concepts, you look under training and you sign up for either the webinar or her live training and enter the coupon code Mom and Mind, you can get 10% off, which is so gracious. Thank you so much for offering that to everyone.
You're welcome.
Yeah, that's really cool. Just for Mom and Mind listeners. Hey, so get on that. And I'll be sure to put that in the show notes and also in anything I post on social media so that you guys can share this as well. All right. Is there anything you'd like to leave us with, Shivonne?
Pretty much just thank you for having me on your podcast. And for all the listeners out there, I mean, there's always something that you can do to help another mom in need out there. So whatever you do, feel free to keep the positivity flowing by trying to create something that may not be out there already.
Yes. Oh, that's so good. Thank you so much for your time and your expertise and all that you're doing to help moms. Thanks for being on with us.
Thank you.
Thank you so much, Shivonne, for coming on and talking about these really important concepts and things that we should all be taking into consideration. And what's great is that Shivonne will be offering her perinatal mood disorders in minority mental health on Friday, September 28th through a live webinar. And she has graciously offered a coupon code to the Mom in Mind listeners for 10% off the webinar and also live in person. So if you'd like to jump on that, you can go to akomacounselingconcepts.com and look under training and use the coupon code MOMANDMIND, MOMANDMIND. For those of you who are just joining the Mom in Mind podcast, be sure to subscribe so that you don't miss any of our weekly episodes. Please find us at momandmind.com, Facebook, Instagram, and Twitter, and you can catch the Mom in Mind podcasts on all major listening platforms. Thank you so much for joining us, and until next time. By joining us today, you are part of the growing community of people who are aware and concerned for mothers and families during this beautiful and sometimes very difficult time of life. If you or someone you know is having a hard time, help is available. You can feel better. Please look for resources for help at momandmind.com. Together, we can support moms and families so that no one has to deal with this alone. Thank you for listening and being a part of the Mom in Mind community.